All right, are you guys ready?
Yeah.
Yes.
Are all of you at home ready? Good. I think everybody's ready. Let's jump in. Good afternoon, everybody. Welcome to GoodVision Liberia. We are on the outskirts of the capital of Monrovia in a community called West Point, a community of over 100,000 people. Today, we're celebrating an eye camp. We have over 250 people here getting their eyes tested and getting eyeglasses, transformative, life-changing eyeglasses. What we are addressing at GoodVision is a global issue. There are over 950 million people in the world that experience preventable vision loss. This is the issue that GoodVision works every day to solve. This is the issue that we're solving here in Liberia. The impact of this preventable vision loss is staggering. For school-age children, it means lower rates of literacy, higher absenteeism, higher dropout rates. And for adults, the issue continues. We've got lower employment rates, lower earnings. People cannot provide for their families. What we've discovered over the last 13 years is that with a simple pair of glasses, we can change all of this around. And that's what we're doing here in Liberia today. The economic impact globally is also staggering. That 950 million people who are not able to work as they could or should equals $411 billion in lost productivity around the world. It's unbelievable. For an investment as little as $1 for a simple pair of glasses, we can turn this thing around and make sure everyone, no matter what their vision is able to live a fulfilling life in their community. Today, you're going to witness firsthand individuals here in West Point having life-changing eye care by some of the most talented eye care professionals here in the region. You're going to also have a chance to connect with dedicated staff and hear their stories about how they've been trained and have developed careers in eye care in order to increase the capacity here in Liberia. With me today is two people I want to introduce you to. First is Alice Mwangi, who is our regional director here in Africa. And to Alice's left is Jackson Smith, who's our program director here in Liberia. So I want to pass it over to Alice.
Thank you, Matt, and hello, everyone. My name is Alice Mwangi. Matt has said I'm the regional coordinator for Africa, and I'm in charge of strategic operations in this region. Just to paint a picture of what is in Africa. Africa carries a significant burden of blindness and visual impairment. We found that 1 in every 6 blind people globally live in Africa. Again, 12% of people who require glasses or surgical interventions cannot access them simply because those services are not available, or there's inadequate eye care infrastructure in the region. And most importantly, we have acute shortage of ophthalmic workers in the region. To give an example, in Africa, we have 1 eye care personnel serving close to 500,000 population. This is compared to 10,000 in developed nations. We have also other barriers that affect our eye care access. These are related to economic issues. Many people cannot afford eye care services, either because they cannot afford to pay for the services, or they have to travel long distances to access them, or they also have cultural barriers that deter them to access these services. So unfortunately, women and rural populations and older people are most affected. So as a solution for GoodVision, we are working closely with local communities to provide and increase access to not only quality eye care services, but also sustainable eye care services. We work closely with the Ministry of Health to support them, to ensure that these services are available. We are also working closely with the local communities to ensure that we are building their capacity to be able to deliver their own solutions to the problems locally. We have trained vision technicians to deliver these services, and we see them going to the community to give the services to places where these people have never had access to the services. What you see today is a work that GoodVision does in all our countries. And we are privileged to have you on board, to have first-hand experience of the work we do. We're excited because we are creating lasting solutions and bringing changes to people's lives. So thank you very much. And I wish to hand over to Jackson, who is our country lead in Liberia. Sorry.
Yeah. Thank you so much. My name is Jackson T. Smith. Thank you, Alex. And I'm the director or program manager for Liberia. And today we are currently at the West Point community in Monserrate, Monrovia, the capital of Liberia. And it's an honor to have worked with the community to have this unique camp here, that we have this number of people attending today. And we also want to say that vision care in Liberia is a challenging situation. For example, in Liberia, we have 4 ophthalmologists for the whole country, meaning there are 2.5 million people to 1 major eye doctor, which is an ophthalmologist. And it's a huge, huge challenge for us as a country. And apart from that, normally to access our healthcare in Liberia for rural community is challenging, to the extent that people have to leave from far community, hard to reach community, hours, days to get to where they have vision care, even if that is available. So what GoodVision does in Liberia primarily is to take vision care to people in rural community, people to faraway community, those that are in need, and those that cannot afford, most especially vision care. And it has been an important part of our work. Let's look at the country, for example. What is our approach? What we do, like what you see here today, this is basically our daily work as GoodVision Liberia and other countries around. We move to communities like this, do this process with the community leadership, and this has been our daily routine so far. And one of the most powerful tools that we have received in recent time is a bus that was donated to GoodVision Liberia by Let's Stop the Girls. And that bus has been so useful to us to the extent that we have had the privilege to go to far and rich community. First, when we started at GoodVision, we used to carry our things on bikes, moving from one community to another community, providing this kind of services that you see here today. But when the bus came in, it made it very, very unique, very easy, and it served as an opportunity for us to reach more community, not even in Monserrate. We have had the opportunity to work outside Monserrate, outside the capital, and we had the opportunity to serve more people. And briefly, I will close by saying, we are going to also give you the privilege to see, apart from what we are doing here today, we're also going to give you a privilege to see firsthand of what we can do and the impact of the bus, what the bus has had, the impact the bus has had on GoodVision Liberia. So right now, you're going to take a look at a snapshot of other activities apart from what we have had here today. Thank you so much.
We are currently at the Glozon Fendelt community, and we came, this is a special eye camp in honor of Mr. Charles Bidell, a sponsor that donated a bus to GoodVision Liberia. So as a team, we have decided to have an eye camp in his honor. So that's why we are here.
This is Glozon community behind the Fendels agriculture farm. From Monrovia to this community is about 10 to 15 kilometers. Yeah, well, I'm Mr. Chie Saki. I'm one of the residents of this community. All right, first of all, I would say thanks to God first, because He's the creator. And next is the GoodVisions, member of GoodVisions, in young men and women that are very trained to take care of people concerning the visions. It's a lot of help for this community. This is not my first time interacting with GoodVision. GoodVision, once upon a time, came to a community that I live in also. That is the same community. They did extremely well by treating people who cannot afford to go to hospital. They treat them free of charge, gave them glasses. Over 50 persons were treated at that community in my presence because of their good initiative, and they asked me to call on GoodVision to come and do SIM to their community. This is how you see us here in Gloson today. And as you can see, so many of the people are here coming from different villages to come and attend these services, which is very free of charge. So I want to appreciate GoodVision.
My name is Hannah Lam of Gloson community. I'm very happy to see you, GoodVision Liberia in Gloson community coming to aid the eyes problem, because we have so many eye problems in this community. My very self speaking to you, I've had a series of problems with my eyes. And then the eye will get dim. It will be very difficult for me to see when the sun is shining. But this day, with GoodVision in this community, giving me these glasses that I can see and recognize objects. So I'm very grateful to GoodVision Liberia by coming to our rescue in this community.
My name is Ade Wilson. I started working with GoodVision since 2019. Yeah, so before the birds, we had a lot of challenges. Like going on the field, 3 persons sitting down on a motorbike, it was risky for us. But now the bus is here and make our work easy. We go from places to places out of Mercy Rider without facing any difficulties.
My name is Thomas T. Double Jr. I'm one of the vision technicians at GoodVision Liberia. I've been working with GoodVision since 2019. There has been a great change and a greater impact with the bus. Because like instance in the past, we had to tow canopy on motorbike, tow our materials, boxes on motorbike to move from one destination to another long destination. And for me, I can recall, there was a day that I had an accident because of the motorbike. Firstly, I want to say thanks to Mr. Bidia and his family for removing country like Liberia that is very, very cold, where access to movement is difficult. Thinking of country like this, I'm grateful to him and to his family.
My name is Jackson T. Smith. I'm the country director of GoodVision Liberia. Before the coming of the bus, we had numerous challenges, and those challenges put our staffs at risk. Since we received the bus, particularly it has made movement very, very easy. It has increased our impact in communities. It has increased our distribution strength, and has also given us the ability to go to distances that we never used to go to attend ICAM. And today being an example, we are like almost 15 kilometers from our current office. So it's a plus having the bus, and it's an honor he remembering Liberia to give us such a unique asset to our project. Message to our stakeholders and partners is that we need more support to reach out to more people, because the issue of eye health in Liberia is a very, very huge concern. It's a primary concern from the Ministry of Health level to all the districts and all the counties in Liberia. So my kind appeal to partner and stakeholders is that we appeal for more logistical support to be able to reach more people, because the issue of eyes is a very, very alarming situation in Liberia. So thank you very much, and we appreciate, and those that will be watching this video has the ability to contact GoodVision Liberia, GoodVision USA, GoodVision Worldwide. Everything you do for the GoodVision family is tend to give people better life, better sight.
Thank you, everybody. Welcome back. With me now is one of our GoodVision Liberia employees. If you don't mind, is it okay I ask you a few questions?
Yes.
Excellent. All right. Can you first please introduce yourself, who you are, and what you do for GoodVision Liberia?
So my name is Doris D. Wilson. I'm GoodVision Liberia GBT, representing GoodVision Liberia.
Excellent. Can you tell us about what motivated you to become a GoodVision technician?
So I wasn't having a plan to be a GoodVision technician, but after I graduated from high school, nothing doing. So a friend of mine called Jean Swat, but he's not personally here, he's in the USA right now. He told me that GoodVision will be recruiting staff. So I told him that I want to be a part of GoodVision staff. So that he invited me over and accepted it, and it went well with me.
Can you tell everyone a little bit about the training you went through to become a technician?
So the training was great, but at the beginning it was a little bit tough because I'm my first time. So I went through the training and I was somebody that was a little bit a shy person. I always used to cry, but since Marty used to encourage me, say Doris, you can make it. Even though I'm not a dull person, but I'm a shy person. So anytime they call me up to express myself and carry on the eye procedure, I used to be ashamed and shy. I used to shed tears. But certain sometimes I start creating confidence in myself. So I start creating passion for the job, and basically I learned GoodVision work and the updates correctly.
Can you tell us a little bit about eye camps like this? How many people do you typically serve at a eye camp?
So every eye camp I can attend to 75 patients a day because we was only 3 on a team at that time. By that time, they don't recruit the other new GBT yet. For my team to be, we were only 3 on teams. So only me was doing the screening at that time. So I used to attend to a patient a day, 75, sometimes 80 patients a day.
Yeah.
Yes.
That's amazing. Incredible impact. Is there a time that you can remember that you felt that your impact was particularly felt in the community? Is there a time that you can remember?
Yes, I can remember. So I went in a community, or Lily was discouraged about her eye, and I encouraged her. I said, your eye can be soft. If I go on with the eye procedure, if I do your test, you'll be able to begin your sight again. And I encouraged her, and she was happy after the test, and I prescribed correct lenses for her. After the, and she also appreciated me for that.
Excellent.
Yes.
Thank you so much for sharing your story today and for all the work that you do for GoodVision. I appreciate it. I think we have someone else waiting also to say hello. Can we just test your microphone, make sure it's working?
Hello.
It's working. Excellent. Okay. How are you? Can you introduce yourself, say your name and your role with GoodVision Liberia?
Okay. My name is Sikonche T. Papa, and I'm one of GoodVision eye technician.
Can you tell us a little bit about what prompted you to become a GoodVision technician? What drove you to do this kind of work?
Okay. So firstly, I want to say I'm very grateful. But when I got the information about GoodVision from a friend of mine called Toga Jita, who is not with GoodVision again, I was very much glad with that idea. And looking at myself as someone who was already in the medical field, I took that as an opportunity to make good use of. But looking at my background, my father was somebody who suffered vision impairment. So before his death, he went blind, and then I felt somehow disheartened. But when I got the information, I said, oh, it's important. So I believe that if someone was not able to save my father, I might be able to save somebody too. So looking at that, I make good use of it, join GoodVision, and today I'm glad that I'm able to help somebody who is having a vision impairment.
Yeah, I mean, it's pretty clear that if you yourself don't experience a visual impairment, you're pretty much guaranteed that you know someone who does. Can you tell me about what the typical reaction is to when the GoodVision team comes into a community? What's the community response like?
Oh, with that effect, when GoodVision visit a community, the community response can be very positive because they can be glad to receive a team that is willing to help. And that's an issue in Liberia that we are really faced with when it comes to the vision issue. So you have GoodVision in your community helping you. It can be very, very encouraging, and they praise GoodVision a lot.
That's amazing. I'm very curious if you find that there are misconceptions in the community about eye care. What do you feel that you and your team need to communicate the community on most?
Okay, sometimes if we got a misconception about eye care, what we do, firstly, we encourage people in the community because some people don't have knowledge when it comes to the caring of the eyes. So we counsel them, tell them more about the eyes, make them know the importance of the eyes. And once they are convinced with the kind of information we gave them, I guess that from that end, we get the best kind of result that we need.
Amazing. I appreciate you sharing your story today. I appreciate the work that you do for GoodVision Liberia. It's great to have you part of the team. Thank you very much. I appreciate that. We've got one other member of our team here who's going to share her story. It's nice to see you.
Hi, Mike. How are you?
I'm doing good. How are you?
I'm fine.
Can you just quickly introduce yourself and say what you do for GoodVision Liberia?
Hello, everyone. Hello, Jen. Hi. Hi. I miss you. Okay. My name is Marty Yatu Morris. I'm the optical lead for GoodVision Liberia, and I've worked for this project since 2018 December. That's when I joined GoodVision as a volunteer. So currently, here the optical department as the head. So I'm responsible for training, quality control, and the entire team that goes on the field to do the day-to-day activity. They are in my care.
Matty, you've been doing this for a while now. What are some of the most common eye issues that you come across at eye camps like this?
Okay, so at eye camp like this, most times you will see people that have cataract. You will see people that have refractive errors that they are not even aware that they have. You have children, especially with FANA. It's a condition, a allergic condition where the eye issue lasts, and because of that, someone could go blind.
We recently started to use a new patient data app here in Liberia as a way to make our work more efficient and more effective. Can you tell everyone on the call today a little bit about that app and what kind of impact it's having on the work that you do?
So firstly, it have made the community excited. The first thing is they tell you that, oh, I'm not carrying paper. So the app has created a situation that people are no longer taking paper along with them. And they have this tag that we use to register them. So the tag goes from the registration, it goes to the eye test, and all the way to the table where the glasses is dispensed. So people are excited. And some of them are excited because we take their photos attached to their name. So they are not carrying paper, but their information is already at the desk to where they will get it. So when we get to the facilities, when we send the data up in the clouds and people are able to see it.
Amazing. Yeah, it's really going to change the way we serve communities.
Yes, exactly.
And report to the world the kind of impact that you're having.
Exactly.
Yeah, amazing. Before we wrap up, is there one story that you can think of when you reflect on your career with GoodVision that stands out for you?
Yeah, so I will always say Your eye, your life. That's my motto. That's what I believe.
Let me just repeat that.
Your eyes, your life.
I love that.
Yes, that's my motto. That's what I believe. Because in Africa, for example, when you have one blind person, it means that the entire family is gone, the community is gone. Because you will always need a child to stay there to take care of that person. So because of that, the family is impacted, the society is impacted. So we had a situation, we went to this school and we came across this child that needed glasses. And the entire students were kind of excited. She can see, she can see, she can see. And Philomena got a pair of glasses that changed her life because in class, it means that she could see now to see her lesson well. And that was a great thing for me.
Amazing.
Yes.
Amazing. Thank you for helping to make Philomena's story possible and for the story for the 250 people here possible.
Yeah.
It's pretty amazing.
Yeah.
And I think right now we're going to connect with some of the individuals, some of the patients here today, right?
Yes, yes, yes.
Do we know who those people are?
Yes. So they are right at the back there. We'll go there and pick them up to come.
Let's bring them on up.
Okay.
Yeah,
Thank you.
absolutely.
Okay.
Oh, right here. Excellent. Thank you. Good afternoon, sir.
Good afternoon.
It's nice to meet you.
Also good to see you.
Thank you for agreeing to be on camera today. Could you do me a favor? Could you introduce yourself and tell everyone who you are and what community you come from?
Okay, so I'm Honorable Mafasin Dawe. I'm the Commissioner of Township of West Point.
Welcome.
Township Commissioner.
Thank you for welcoming us into your community.
You're welcome.
Are you here to get your eye screened today?
Yeah, I went through the process.
Tell us about the process.
Well, I think it is amazing because it is a bit easy to go through the process. It doesn't take you a lot of time. And in no time, I went through the process and I received a pair of glasses.
You did?
So I'm a beneficiary of the exercise also.
You got glasses today.
Yeah.
How long have you been experiencing some kind of vision loss?
Well, it has been some time. It has been for more than 10 years.
More than 10 years. And is this the first pair of glasses you've received?
Of course.
Wow, 10 years. So can you tell us about your job and how your vision loss over the last 10 years has impacted your work?
Yeah, there were several challenges because at a certain point in time, when it gets so severe, you do not see anything at all. Sometimes you suffer blurred vision. Sometimes you don't have the time to look in the sun, tears run from your eyes. So whenever I'm going through that process, there's no way to do anyway.
You couldn't do any work those days.
Because the eyes, that's what makes you the human. In the absence of your eyes, I mean, it began challenging for you to
So
do
after today, when you go back with your glasses, how do you see your life changing?
Well, when I tried to do some little reading on newspaper,
yeah,
and I could identify the writing easily. Unlike when I went in with eyeglasses, I had to strain my eyes to identify the writing. So from today's experience, I know that it's gonna enable me to do more reading. They're gonna enable me to do my work easily, where I will not be in the position to strain my eyes to see what I'm doing.
Excellent, excellent. I'm very curious. How did you first hear about GoodVision? How did you first hear about this eye camp today?
Well, I heard about GoodVision from the awareness team that is sent in the field. When they got to the office and contacted me as commissioner of the township, I was so excited and I couldn't wait for GoodVision to be here because I know there are many of us who are going through the challenges or having difficulties in seeing clearly. So when I got the news, I had to join GoodVision to inform my people that indeed today would have been a blessing for us. And today, according to the promise, they are here and our people are here. We are all excited to receive you today.
Yeah, it's a pleasure to meet you. Thank you for your community leadership, and I'm glad we connected today. I really appreciate it. Thank you for agreeing to be on camera.
You are most welcome, and we hope to have this partnership with you throughout.
I hope to be back. Yeah, thank you very much. I think we've got someone. Hello, how are you?
Fine.
Thank you for agreeing to tell your story. Can you introduce who you are, your name, and what community you're from?
I'm Joseph A. Jackson from the Township of West Point. I'm so happy to be with you guys today because yesterday they were going around spreading the news that there was the eyes problem. So myself, I told them that I would be part of it because my eyes sometimes gave me problem when I own my phone. They lack refreshment. Yeah, they can't even see too correct. So that is the reason I'm here. So I'm so happy for you guys coming to our area.
Yeah, we're glad to be here. Yeah, thank you. How did you first find out about Good Vision and this iCamp?
I would have found out about Good Vision because I heard that they came to save and help people who there's so many problems on the eyes. Yes.
And you already got your eye screen today?
Yeah, yes.
And you got a pair of glasses today?
Yeah, it is.
Excellent. So now that you're going with a pair of glasses today, can you show everybody what you got today?
Put it on my face, huh?
Yeah, yeah. Excellent.
Yeah.
I like the
There's
blue.
the glasses I will be using when I'm on my laptop phone. Yeah, so that my eyes can be screen too much. Yeah.
So now that you've got glasses, what do you see the changes in your life is going to be?
Oh, it's very good. Moving on good. Yes.
Excellent. For people out there that are not familiar with Good Vision and not familiar with these iCamps, what would you tell them in order to convince people to come to these iCamps to get their eyes screened?
We spread the good news so that other people can come who are ill to get better on the eyes.
Is there anyone else in your family that experiences vision loss?
Yes, yes.
And are they here today?
Yeah.
And they're here today?
I have one at the back there.
How many members of your family are here today?
I have about 3.
3 members of your family?
Yes.
That's great. And
there's the other lady. Yes.
Excellent. Well, I'm so grateful you came out. Thank you for sharing your story with us. It's good to meet you.
Thank you.
Enjoy those glasses. I very much like the blue tint.
Thank you very much.
Yeah, thank
May
you.
God bless you guys.
I appreciate that. Thank you. So just a few examples of the many beneficiaries that are taking advantage of the iCamp here in West Point. I think we have one other individual coming. Hello.
Sorry.
How are you? I'm Matt.
I'm Mike.
Nice to meet you. Would you mind saying hello to everyone on camera and introducing yourself?
I'm Mike. I'm so happy today to be counted among those that are receiving these glasses because I came from Grand Baza. I came to visit and I hear about it. I say, wow, but then to go and be part of this. So I'm so glad, I'm happy. Thank you and thank you and thank you and thank you.
Well, it's this
May God bless you all. Thank you so much. I'm so happy. I'm so glad. Thank you. May God bless you.
And you're already wearing your new glasses?
Oh yeah, I'm wearing my glasses. I can see well. These things that I don't used to see, I can see now.
Tell me, before you had glasses, what were some of the challenges you're experiencing each day?
Yeah, it's challenging where I can see like something jumping in my eyes. I can't see this thing when I'm walking. When sun hot, I either wear something in here. I either wear something for the sun. Light when I walk, I don't walk fast. Yes, that deal. But now since I wear the glasses, at least.
So what was it like? I'm very curious, and you can tell everyone who's joining us online. What was it like when you first put on your pair of glasses? What did that experience feel like?
I feel like because before I used to see like dew, but when I wore the glasses and I saw on the wall, I don't see the dew. So I felt so happy. Like no more, I can't see the dew again on my eyes. So I'm so happy.
It's amazing. I'm so glad.
Yes.
When you think about your community and others in your community who may experience vision loss, what is it that we could be doing better to educate and communicate to them that there are solutions available?
For these glasses, if we can help them with these glasses and reach them, because they are said and needed. They got people that don't even got money to go to the hospital, to spend money to even do their eye and something, or to even do their eye tests.
Right.
But if you go in the community and give people free to do your test, free, you get glasses free, you know what it means?
Right.
It means a lot. It means a world to somebody.
What do you think is the #1 obstacle to someone here in the community who experiences vision loss to coming to an iCamp like this? What do you think is preventing them from coming?
What is preventing them coming? Like you have not reached them yet.
They just don't know yet.
Yes.
They don't know yet.
Yes.
So our outreach and our education is really a critical piece of the equation.
Yes.
Yeah. Excellent. So you have your glasses now.
Yes.
What do you think tomorrow is going to be like for your first full day with your new glasses?
Wow, my tomorrow will be great. My tomorrow will be greater. My tomorrow will be happy.
Yeah. Excellent. It's been a pleasure to meet you.
Thank
you for sharing your story. Thank you for being here today.
Thank you so
Yeah,
much.
thank
I'm
you.
so happy. I'm so glad. Thank you.
Uh,
Yes, thank you.
Obviously, just a few of the many stories of transformation that we have here at the iCamp, just outside of the downtown area of Monrovia. We have the opportunity now for all of you who are joining us online, if you'd like to ask a question of a member of our staff, of Jackson, of Alice, of a beneficiary, if you want to ask a question, we will do our best to get it answered. Just use the chat and type in your question and we'll work on getting an answer for you. So, okay, here's the first question. Thanks, Helen, for the question. This is Helen. What was the biggest challenge for your team regards to approaching communities and creating trust? This is a question for you, Jackson.
Okay, thank you so much. First of all, honestly, that has been a big challenge. But what we have done as GoodVision Liberia is to build trust, in the sense that our services linked to the trust. So when you get into community, first of all, you have to work with a community leadership, which is key. After getting to know the community leadership, you develop friendship with the community leadership, and you work through the community leadership to serve the people at that level. So most time, it's not really a huge challenge for us, because we also have people that are trained on community entry, that when they get to community, they know how to navigate their way to get to the top and get people coming for our account. So that has been a challenge from the beginning, but subsequent time we have gone over it to know that it's not a major challenge. Because most time, because of the challenge of our health services in our various communities, most especially in rural Liberia, the community leadership are always eager to work with you because you are serving their people.
Yeah.
So it has not been a huge challenge in that direction.
Please,
I
Alice.
can also add and say that after the service, if you are providing quality services, there is word of mouth that spread through the community. And now when you are holding the next camp, the crowd will become bigger. So quality of services also matters.
Yeah, so it's a combination of finding the right balance between strong technical expertise, but also public relations and community engagement, developing strong relationships with the communities, to build that trust. Yeah. We have another question here from, let's see, it's from Jen. It says, this is a great question. I love this question. What can GoodVision supporters do to help? So for people out there watching this video, what can they do to help our program in Liberia and around the world?
Okay, what I would say is that visual impairment is a huge problem, not only in Africa, but the rest of the world. But in Africa, we carry, we carry the burden of visual impairment and blindness, and it's affecting people's lives. So how you can help is to support our program that cut across Africa. We have programs in Malawi, we have Tanzania, we have Kenya, we have Burkina Faso, and of course Liberia. So, and what we are doing there is building the capacity of the locals to be able to provide eye care services, like what you can see now. These are locals, people who have been trained to provide the services. We provide them also with equipment, and we also give them logistic support so that they can move closest to the people. So that kind of support will really help us go far.
I love that answer. I love this question too. I'll just say a couple other things. One, as I mentioned earlier, it costs $1 in materials to build our glasses, only $1. So when you think about the kind of investment that can be made, every dollar that's invested in international eye care has a $36 return on that investment. So think about how far your investment in our work could be. It can go a long way. So what I would recommend to anyone who's watching this video is visit goodvisionusa.org and consider making a contribution, a monthly contribution to our work. It goes a long way to have a huge impact. We've got another great question here, and it's for you, Jackson. It's what are your plans ahead? What do you have in the pipeline for 2025? How many people are you hoping to serve? How are you going to get there?
Okay, thank you so much. We have a distribution target of reaching about 6,000 individuals this 2025. And that our focus is not even based primarily in Monserrado. We want to take the services to the people in rural Liberia, because in rural Liberia constitutes 70% of our total population. And at that level, 90 or 95% of people has not had the opportunity to experience our healthcare. So we have a target of 6,000, and we could even do beyond 6,000 if we have much more greater support. So our primary target is 6,000 individuals to distribute. And apart from that, we also have another target, which is the cataract support program. We also have a mind or a target to provide cataract surgery to as many people as possible once we can have this logistical support. We currently we are looking at around 50, 75, but if there is no capacity, because currently we have about, in one county, we have about 700 patients that are waiting currently on cataract surgery list, and there's no one to help sponsor them. So if we can get to that level, we can even increase our cataract projects.
Yeah, incredible. You were describing earlier how in Liberia, there's only 4 ophthalmologists for 5.5 million people.
Yeah.
It's definitely a lot of resources are needed here. And GoodVision is trying to solve this problem.
Oh, no, definitely.
The other thing I would say to the people watching at home is, in addition to donating, share the story of GoodVision. Tell your friends, your family, your coworkers about the work that we're doing. We need to change the dialogue, elevate the awareness of the work that's happening here so more people can be part of the GoodVision community. So another thing to think about as you're out there reflecting on what you saw today. We do have another question. Okay, this is another good one. The question is, when you travel into rural communities, how long do you run the iCamps? And are you able to stay for more than one day if necessary?
Oh, yeah. Thank you so much. Because our office is currently located in Monrovia, and we also organize camps in rural communities. To answer your question directly, yes, we stay more than one day in rural communities, depending on the number of people we have to serve. For example, there was a time that we visited a community called the Bone Mines community, and we had to stay there for a week. What we do is that we take all our materials there at once, and we stay there for a week, and we work there for the whole week. Yeah. So we do that very often. We have gone to Kema, we spend 2-3 days there, depending on the number of people we have to serve in a particular location. And one of the things that is very strategic to us is that we don't get to a particular location and leave people there that is in need of these glasses and say, okay, because we have a day here, we have to leave. No, we don't do that. So when we get there, no matter the number, once we have identified that we are going to this community to work, we must stay there and have the people served there before we leave.
I heard that before we got this wonderful donation of the minibus, we would take the staff and the materials on motorbike to go to the community, which not only is more difficult and more inefficient, but it's dangerous.
Very dangerous.
The impact of this minibus is pretty significant.
Very, very significant in the sense that we take more materials. We can stay much more longer in different communities. And that has helped us, and it has reduced the risk on our staffs. Because, for example, we go into, 15, 20 kilometer distance. Then you ride, you are on bike. That's very, very strenuous. And at times, we had to take this risk because we have to serve. And I must appreciate their efforts then, their courage then before coming off the bus. They took those decisions. 3 pricing, 2 pricings on bike with material, sometimes rain, sun, and we have to go there because we identified an issue there that needed a solution. Amazing. So it has been great. So the coming of the bus has elevated that to a certain level that we can conveniently move to any community and say, we stay here 2 days, 3 days. And that, back to the question that I just answered, that has also helped in a way that we can spend 4 or 5 days somewhere because we can carry more material at once.
And just remind people, how many people are you planning on serving this year alone?
Oh, we are planning on serving around 6,000 and above this year.
6,000 people and above. Amazing.
And that's only for glasses distribution.
Right.
Yeah.
Not just eye screenings.
Yeah. No, eye screening, we might do around 16, 18, 20,000.
Right.
Because also, apart from the normal glasses, there are other online learning cases that we might identify that we might not get glasses immediately, we can do referral. We also have this referral program, the Caterpillar referral program, where we identify people that need surgery and we do referral for them.
That impact is about double last year. So 100% increase in impact just in 1 year. The future is bright for GoodVision Liberia, but it does require everyone's support to make this happen.
Definitely.
I think it's about time that we start wrapping up. Is there some closing comments, Jackson, that you'd like to make?
I would like Alice.
Alice to do it?
Okay, thank you, viewers. What you have seen today is what happens every day in Liberia, and not only in Liberia, in all the 10 countries where GoodVision is. In Africa, as I mentioned, we are in about 5 countries, and this is the life of our teams, going to the remote areas to ensure that everyone has access to vision care. And most exciting in our work is that we have seen lives transformed. We have seen families like those represented today, those who receive their glasses, their lives are going to change, their livelihood is going to change. Children perspectives and our future is going to change. And so it's exciting to know that you are making a change in people's lives.
Wow, that's great. Thank you so much. And from Liberia, and I want to say we so much appreciate the team for also joining us today here. And I'm honored to be a Liberian, that to be part of this great project. And it's a privilege being here. So I want to say thank you to everybody. Thank you to Mark. Thank you to Alice. And thank you to the audience for joining us. Thank you to the camera team, the staff that put this on, the community, everyone. I just want to say a big thank you. We can do much more better together, definitely. With your support, with their hands on decks, we can go much more higher than even what we have targeted for the year. So that's great.
Agreed.
Today has been very wonderful for me.
Yeah, thank you.
Yeah.
Thank you for bringing your team out here and allowing cameras into your workday. I know that is a little disruptive.
Oh, no, definitely. And we don't normally have cameras during our work time. So today is just a special day.
It is. The team has been fantastic and very accommodating, and the whole community has been great. It's really a privilege for me to be able to call you both coworkers and to be able to do the transformative work that we're having. And I just want to remind people at home, again, if this is something that you want to be a part of, if you want to have a direct impact on communities around the world, visit www.goodvisionusa.org. Consider making a monthly contribution to our work. We would greatly appreciate it. So on behalf of the over 500 employees that are in communities across Asia, South America, and Africa, thank you very much for being here today. We really appreciate it. We hope to do it again sometime soon. So thank you and have a great rest of your day.
Have a great day.
Yeah, thank you. Thank you, Alice.
Thank you, Matt.
Thank you, Jackson.
Thank
you.
Alice, it was great. It was good. Thank you.
That was great.